Hi, I'm Nikki Venere Brenner. I'm a registered psychotherapist and the owner of a group practice called The Mind People. Today's topic of discussion is eating disorders. Specifically, I'm going to talk about anorexia nervosa. If you're not too sure what anorexia is, or if you're someone who is struggling with problematic eating, but you're not too sure if maybe you fit the bill of having a diagnosis of anorexia, well then stay tuned. So I'm going to break it down for you. The diagnostic criteria associated with anorexia nervosa specifically incorporates restrictive eating insofar as to engage in this compensatory behavior, this problematic behavior, as a way to lose weight. So individuals who struggle with anorexia typically have a fear of being fat. So this means that they fear if they were to eat, then they wouldn't be able to stop eating, and then all of a sudden they would manifest into someone who is 600 pounds. So they are very concerned, and they use a way to modify and restrict their eating habits, so then this way they can lose weight. So someone with a diagnosis of anorexia nervosa usually has a particular BMI, body mass index, that falls below the average or the standard. There are also other factors in accordance with that, but I'm not going to confuse you because I do want to highlight the psychoanalytic components to anorexia nervosa, which I think is more beneficial in terms of understanding the dynamics of anorexia compared to just understanding what the symptoms of anorexia nervosa look like. So when we're talking about the psychoanalytic perspective of eating disorders such as anorexia nervosa, we do want to highlight that the compensatory behaviors are a way in which someone can avoid their painful feelings. So if you think about this, you might be a person who is struggling with restrictive eating, or you have a diagnosis of anorexia nervosa. So what has happened, and usually this happens or this dynamic or trauma occurs in childhood, is that individuals experience particular exposures to trauma over time, and this results in a kind of attack on the self. So more specifically, say for instance that you had a parent who was very strict, very structured, very much needing to be in control, maybe an anxious parent. And this is someone who has instilled, very specific rules and maybe a standard to live up to. So for instance, you needed to perform academically at a certain standard. You couldn't fall below that standard because then you would be reprimanded in some capacity. And let's say that trauma has then evolved, and the relationship between you and your parent now has gotten significantly worse. So as a way to try to cope with the emotional load, one might engage in restrictive behavior. So if someone, let's say a teenager who is 13 years old, feels as though that he or she or they don't have control over their life, they can't go out with their friends, they're not able to do the things that they want to do, even within reason that a 13-year-old, maybe has some power and control over doing, they're not given that luxury. So the only power and control that this person has is a way to restrict their eating. So then they begin to restrict as a means to reestablish control. But then over time, the restricting might not necessarily be a way to reestablish control, but might be a way to please that parent who is usually not able to be pleased. So then you begin by trying to establish a body type that is now in line with some form of standard the parent has. So for instance, if you can't academically reach this parent's standard and you're falling short and you're constantly reprimanded, well, maybe if you looked a certain way, the parent would be more accepting and then overlook these academic challenges. So sometimes this is consciously, but mostly it's unconsciously occurring in the individual's mind. And again, this just doesn't happen or just doesn't manifest let's say overnight. This happens over time. And just because someone begins to restrict their eating, again, this doesn't mean that the trauma or the pain has occurred at the time of restriction. The pain occurred way before that. So if we think about risk factors, when we're talking about what contributes to a diagnosis or a psychoanalytic perspective of anorexia nervosa, we start to think about infancy, and we start to think about at least Freud's psychosexual stages of development, specifically the first stage of development, which is the oral stage. Here, people are usually faced with a conflict, and that conflict has to do, at least with the dynamic of overeating or undereating. So you need to feel this sense of pleasure. You need to balance pleasure and frustration. And if pleasure and frustration aren't balanced, let's say that a person is overfed or underfed, then this leads to a conflict or fixation at the oral stage of development. So someone who is fixated at the oral stage of development, let's say, will grow up and they will seek pleasures orally, through talking, through eating, through smoking, things like that. Chewing gum, right? You get the idea. So what ends up happening is that an insecure relationship is now developed between the infant and the caregiver. So conflict builds within the infant, and then what ends up happening is that the infant is constantly now frustrated. So now this infant might be crying a little bit more, waking up in the night a little bit more, and now this is aggravating the parents or parent. So then there isn't this strong, loving relationship, maybe because the parent is exhausted, right? The parent is going through maybe postpartum depression or something. But whatever is happening here, a solid attachment or secure attachment was not formed. So now we have this oral fixation that is occurring. In addition to that, the infant is also in the stage, at least from what Erik Erikson described in the psychosocial stages of development, as the trust versus mistrust stage. So if there's conflict that's building because of this oral fixation, in addition to that, then the child is going to have a difficult time trusting the parent. If the parent is unconsciously, unintentionally underfeeding the child, and this is causing frustration in the child, then what's going to end up happening is the child, now the infant, is not going to trust the parent. Is not going to trust the parent to give relief, to reestablish the sense of balance. So now there's this oral fixation, and now there's mistrust that is developed. So let's fast forward now to the age of 2, where now you're starting to learn how to potty train. So this parent who is very anxious, very strict, very overwhelmed, is now training you and really impacting your ability to understand what it means to be toilet trained. So the parent might put you on the toilet and have you sit there, right, until you relieve yourself. And you're not going to be able to move until you relieve yourself. Or if you have an accident, then you're significantly reprimanded and you're made to feel bad. You're made to feel ashamed. And this is very difficult for the individual. So again, at the toilet training phase, if a parent is instilling this in their child, again, unconsciously or consciously, this will result in an anal fixation where someone now needs to establish a sense of control. So we have the oral fixation, we have mistrust, and now we have someone who is anal retentive, someone who is very strict and needs things to be done a certain way. This all happened before the age of 2 years old. So think about this. Now, 2 years old onward, whatever happens is now contributing to that trauma. Fast forward now, and we have someone who is in the puberty stage. So they're trying to understand who they are, they're trying to understand their body, and they can't grasp the changes. And it feels overwhelming, especially for a female who then begins to menstruate and begins their period. Their body can change, right? Begin to grow breasts. The body shape might change from a narrow and straight down to a more curvy. And then this can spark a lot of stress for individuals. So now we have issues during infancy, issues during the toilet training phase, and now issues during puberty. These are all psychic traumas. These leave emotional scars on the mind. We haven't even touched upon traumas that can be life-threatening or that can significantly alter one's perspective and really take away a child's innocence, such as sexual assault. We have all of these traumas that are now building up. So now we have someone who is a teen or preteen, and as a result of all the unconscious traumas that have been piling up over time, the way in which they unconsciously deal or manage with the trauma is to restrict their eating. If I am too much because I have too much emotion, I have too much emotional baggage, then someone can try as best as they can to shrink that. Unconsciously, they do this through restrictive eating as opposed to processing their internalized pain and their psychic trauma. So what ends up happening is they engage in these compensatory behaviors, right, like restrictive eating, and they do this as a defense, as a means to avoid the emotional pain. Because if they process the pain, they wouldn't have to go through those restrictive behaviors in order to lose weight. They would be okay with themselves. They would have a healthy relationship with the self. But the relationship with the self wasn't developed in a healthy way. Instead, it was developed in such a way as now the person attacks themselves through restrictive behaviors. The only way in which someone can stop or significantly reduce their restrictive behaviors is to unconsciously dive deep into the depths of their mind. I've worked with so many individuals who were severely anorexic. They were diagnosed borderline hospitalized because of how well physically they were. And we started off with the standard gold treatment, cognitive behavioral therapy, specifically for eating disorders. And this was a great way to stabilize the patient. But what ends up happening is when this piece is completed, right? Then the individual, at least people who are trained in eating disorders, don't really have anywhere to go, don't really know what else to do. And this is why relapse is so high with individuals diagnosed with anorexia, and this is why mortality rates are so high, is because individuals either take their own life or die because they are starving themselves. And this doesn't need to happen, because if people who are trained in providing eating disorder treatment, and I'm specifically talking about psychotherapists, there are other people who are involved in the treatment, such as family therapists, doctors, psychiatrists, so on and so forth. Like there's a whole team, but I'm specifically talking about psychotherapeutic treatment. Now, if someone is not trained on how to go deeper following the stabilization, because you did a great job, you stabilized the person, and now they're ready to do more work. But the thing is majority of therapists aren't trained to provide psychoanalytic treatment, to dive deep into the unconscious mind, to pierce through the defense mechanisms that are trying to contain the trauma. This is where we get the compensatory behaviors, not the conscious mind. We get it from the unconscious trauma. When therapists, especially psychoanalytic therapists or psychoanalysts who are more advanced psychoanalytic therapists, these are the people who are equipped, who know how to dive into the unconscious mind. When I've worked with patients who have done this, and it takes time, it takes at least a year, committing to at least 2 sessions per week, at the very least 1 per week, but I recommend 2. then you are going to start making significant progress. And that's because you get to dive into your mind and process the pain from infancy. You might not be able to consciously recall it, but your body can feel it, can sense it. You will have the opportunity to process the pain that occurred during the toilet training phase. And then again during puberty, and then again and again and again, especially if the traumas piled on. I have worked with people who have been in terrible shape. They presented borderline, again, like I said, needing hospitalization, and they were at risk for dying. Because we've worked to first stabilize and then dive into the unconscious mind, the patients that I have worked with are not only able to regain a sense of momentum and control in their life and starting to feel more like themselves, but now they're able to understand where their problematic behaviors came from. So at the surface level, there might be a part of the psyche that wants to lose weight. But what for? Are you looking to fit into the crowd? Are you looking to socialize and you feel like an outcast and losing weight will help you fit in? Or are you trying to be noticed by a parent? Are you trying to be seen? Are you trying to have a parent be proud of you? So you're trying to fit in or fit their standard. Again, this could be very unconscious, and it mostly is. Because when individuals are struggling with anorexia, the only thing that they're really thinking about are calories and their body. That's pretty much it. Everything else stems from these two components. So if we're able to process and we're able to explore like what it actually means to have this particular body, or what it can do for you having a smaller body type, then we can start to understand the dynamics of what incorporates, again, these two core components, right? So we're trying to understand the unconscious driving factors that are affiliated with what a calorie is for you, for that individual patient, and what it means to have a particular body type or to hate your body type. It is not uncommon for people who struggle with anorexia nervosa to have a terrible relationship with themselves. They look at themselves and they treat themselves like shit because they view themselves as shit. And that's the problem. If you view yourself as crap, then you're going to behave in such a way as to support that. But if you unconsciously understand those driving factors that are driving that perspective and you feeling like crap, then you can understand that maybe this actually didn't come from you. Maybe this is your internalized parent who is now in your mind and taking up space in your mind, which now is the only voice you are hearing. So you can't even hear yourself. You can't hear yourself that you're doing a great job, or you look cute in that outfit, or you're an amazing friend. What you hear is you're crap, you're crap, you're crap. So then you're gonna behave in line with you feeling like crap. Part of the therapy and a big part of just strengthening your mind involves building a relationship with yourself. A healthy relationship with yourself, where you begin to love yourself. You feel confident. You feel like you can take on stressors, that you're not going to crumble at the face of a trigger, that you can manage it, you can handle it. And not only that, you can grow from it. You don't have to shy away, and it doesn't have to be a difficult situation where you're experiencing these symptoms for the rest of your life. If you understand the psychoanalytic components to anorexia, and you give yourself the opportunity and permission to seek out a therapist who knows how to dive into the depths of the unconscious, then you are way better equipped at building a more authentic and healthy and happy relationship with yourself. And that is a solid foundation that can help build relationships now with other people. Because if you're restricting your food, you're unconsciously restricting your relationships. You're restricting opportunities. You're restricting your life. Allow yourself to live life on life's terms, and you don't have to live in this box or be constrained by the trauma in your mind. You have room to grow. It's just about having the proper resources and the proper support in order to help you reach your potential. You got this. You are resilient and you are well equipped now that you've been listening to me and my channel and providing you with information that you would have probably never have gotten from therapists who are trained in a very generic way. So it's your choice to make the next step. It is not your fault that you have a diagnosis of anorexia nervosa, but it is your responsibility to feel better. And in doing so involves taking action and doing the difficult thing, which is to stop avoiding your mind and dive into the depths of it. Here is where you'll start to find relief. Here is where you will start to understand yourself. Give yourself that opportunity.